These are risk factors for failed neuraxial anesthesia for cesarean deliveries. Approximately 3% of regional anesthetics for cesarean delivery will fail. Increasing maternal size is a risk factor. Morbid obesity significantly increases the rate of neuraxial anesthesia failure, and as maternal obesity increases, failure rates proportionally rise. Doing a late labor epidural placement is also a risk factor. The timing of epidural insertion can impact your neuraxial anesthesia success. Late placement increases the risk of failure during cesarean delivery. Lastly, your decision-to-incision interval can also be a risk factor. A quick conversion from labor to C-section is a risk factor. A short time frame can compromise effective neuraxial anesthesia. So if you make a last-minute decision to get a neuraxial block, then that also puts you at risk for failed block. Spinal anesthesia after a failed block is not a risk factor for failed neuraxial anesthesia. This means that if you tried to do an epidural, were not able to, and instead got a spinal anesthesia, that spinal is not more likely to fail because the epidural failed. But this is a risk factor for high spinal.